Conspiracies Against Wellness with your host, Jonelle Elgaway.
And now, live from Washington, D.C., Jonelle Elgaway.
Good evening and welcome to the Doctor's Corner with Dr. Kline. I'm your host, Jonelle Elgaway. If you have questions or comments, please call in at 415-915-2291. And this evening we have Dr. Kline. How are you doing this tonight?
I'm doing fine, thank you.
Great. So we're both in D.C. Would you like to tell everybody a little bit about what you did today and what's going on this week here?
Well, my book report for the day is that a bunch of doctors got together in front of the United States Justice Department in Washington, D.C. on Constitution Avenue and held a little mini rally. Held up signs and a banner trying to protect people with painful disease. And some of the signs said that the federal drug police are not helping with the matter, and that came up as an issue. But it was more looking for a cooperative effort with the federal government and people who are being denied care and whose doctors are disappearing, either through their own choice and fear of being prosecuted for doing the wrong thing, and because of actual prosecutions. So that's what we were doing, and we held up signs, and they provided 7 police officers to guard their front door, so that we wouldn't rush in, I guess. So we did have a chance to meet one another and talk, and some of the physicians were able to talk with me, and we were able to interact. And we're trying to discover just how bad the DEA portion of the problem of under-treatment of people with rare painful disease is. And I do think the DEA is part of it. The DEA does a lot of good things. They track down fentanyl and they arrest terrorists. But we need to come to a better agreement on how much damage is possible from making medical assumptions about physicians that may not be true.
Right.
So,
do you think that patients and doctors, how critical is it that we both work together and come together? And do you see that happening?
Yes, that's extremely important because patients are being denied treatment and doctors are being held with a gun to their head about, you better stop prescribing this or else you're going to lose your license. Now, a lot of that may not be true, and physicians may be part at fault for not checking out the details. For example, the CDC guidelines says nothing about treatment of chronic pain disease in terms of the 90 milligram cutoff, which is odd because it's guidelines for chronic opioid use.
Right.
But there's nothing in there. 50 pages of single-spaced stuff. There is nothing in there. So part of the problem is physicians are not researching this themselves. They're telling patients that it's a state law. They have to cut back on their pain medicine. That's not true.
Right.
It's not true in any state that I know of, and it's certainly not true from the CDC. So
why isn't it in that 50-page document?
Say again?
Well, why isn't it in there? Why isn't there nothing in there in those 50 pages? Why doesn't it say it anywhere in there?
Well, because I think the document is partially fraudulent, and I say fraudulent carefully. Fraudulent means you are providing information that is not true for your particular specialty, so that's medicine. And the second part of fraudulence is you have to benefit. Doesn't have to be money, but you have to benefit. Now, if you're trying to push an alternate agenda or a radical agenda, and you get people to buy into it and maybe contribute to organizations, that's the second part of fraudulence. So I will say the CDC regulations are fraudulent. And the information in there, by their own admission, I mean, you can look up the quotes yourself. Scientific evidence is low. Well, in fact, there's nothing lower than the ratings they gave it, but our opinion is very good. What kind of statement is that? That's like me standing under a bridge saying, well, there's no scientific information that if you put this great big beam in here, the bridge won't fall down. But I have this high opinion. I mean, you can't say things like that in science, and especially not when it affects people with illness, and especially not when it interferes with a doctor-patient relationship. So I can't really tell you what the motivation was of the CDC to step out of its proper regulatory authority. They don't have regulatory authority to be saying anything about opiate medication. So you need to ask them, and you can ask Dr. Deborah Horry, Houry. She's in charge of the section, and I've seen her on continuing medical education saying things like, doctors are causing the epidemic by prescribing too many medicines, et cetera, et cetera. But I'm sorry, I can't accept that, and I think it is false. And I'm sorry, I drifted off. Working with patients is critical because the doctor is being frightened out of their traditional role, and the patients are being screwed. So, we got a problem that's doctor and patient both. And so we need to work together to get it solved. Doing it alone is not going to be as effective. Doing it together is very effective.
So also, tomorrow, can you explain about what's going on the rest of the week here and what you will be doing?
Well, tomorrow at noon in one of the big legislative buildings in Washington where they have the representatives or the congressmen and women, and they have other buildings for the senators. So we're going to be in a building for the representatives. And for 2 hours, there's going to be a luncheon, and they're going to invite as many staffers as possible. Congressional staffers run the show. They're all very bright. They know what's going on, and they collect and filter information for the representative or the congressman. So there's 15 of us that are going to speak, and I'm going to speak on just the impact on a regular primary care practice because I'm a primary care practitioner. I'm not attached to drug companies. I'm not trying to get grants. I'm just a doctor, and I have just patients. But the patients I see have had their treatment reduced, under treatment. We see suicides. We see people's lives wrecked where they were previously okay by a government cabal, we call it, CABAL, which is the government getting together, the DEA, the CDC, and even Medicare now, to press an agenda. It seems that the federal agenda is not to treat pain.
Right.
And this is going to go down in history.
Why
is
just
the
federal agenda?
It's because the CDC started this. They started the wildfire. They threw the match out the window that started it. The DEA has picked up on it because it's their job to enforce the Richard Nixon 1970 Controlled Substance Act. So with CDC saying, hey, wait a minute, we got all these drugs out there causing the epidemic, then it falls to the DEA to enforce that. I got the first email from the DEA 2 weeks ago. I've been a DEA registrant for 40 years, and I have never received an email from them. So they sent an email out. They sent an email out to all the doctors and all the practitioners And all it said was the CDC regulations are such and such and can be found such and such place. They didn't say we're going to enforce them, but it sure sounds like that's what they're going to do. So if the DEA starts enforcing the CDC regulations that are by their own admission voluntary and unscientific, we got a real problem, because they're going to be enforcing law or enforcing regulations that are not proper and were not properly promulgated according to rules within the federal government. You don't just say things. The Agriculture Department doesn't say to the Defense Department, hey, you can't have jet planes flying over my cornfields because we think that's bad. It's none of the agricultural's business. If they want airplanes not to fly over, they don't make their own rule up. They go to the Defense Department and they say, look, you're the regulatory agency for fighter jets, so here, let's talk about this. The CDC is not the regulatory agency to be passing any type rule, whether they claim it's voluntary or not. It is improper.
Okay.
Okay,
so you're going to be doing that, and I know you're also going to meet with reps, health reps, correct? And
correct.
Senators. Okay. And one thing I wanted to just mention on air is I wanted to thank everyone, because I know it was last second that we kind of came up with saying, hey, if you want to still be involved and call your reps and get an appointment with them, that would be great. I just wanted to say that anybody that didn't get through, we will be going again. So if you want to, just let them know, in a few months, if they can see you, then we can all do this again, or maybe you can come out to DC yourself and see them. So it's up to you.
But in the meantime, because we're here, if you can, go to your senator or U.S. senator, U.S. representative, and remember, if you don't know who it is, just Google who is my United States representative, and they'll figure it out for you. Just put in your street address, gives you the name. You go to their website, you plug in your name, and they verify you're from the district. And then you can leave them messages, and just leave them a short message. I suffer from this. I used to be fine. The CDC is causing doctors to reduce my medicine, and now I'm like this. And say something needs to be done. It doesn't have to be fancy, but you see, what happens is, when we go sit in the offices, maybe the senator or the representative or their staff has been briefed. Hey, we're getting a lot of emails about this, so it must just be more than what Kline and Elgaway are saying, so it helps us a lot if they could be nodding their heads when we're telling them the story. The first time we went down there, we were telling them the story, and they're looking at us like they never heard of it.
Yeah.
That's because people weren't, sending in emails, or you can call the office and leave a little message with the healthcare aide, or you can go in. I mean, they love to hear from people. They really do. And you can just make an appointment, drop in, and just give them your story. Say, here's what's happened to me. Good Lord. We live in the United States of America. We don't live in a cave, where people are denying pain treatment. Good grief. So.
And if you don't mind, if you could quickly just kind of give a short, example of, say if somebody does get in to see their health rep, or say that we're going to go for them and they're going to be coming on through conference call, what is the best way to talk when they get to speak? What should they talk about, first of all? Mm-hmm.
Okay, you state the problem. They want to know what the problem is. They don't want to hear a lot of extraneous stuff. I am a 39-year-old woman. I have interstitial cystitis, which is a rare disease that has caused me so much difficulty. I can't have sex. I can't go to the movies. I can't, tell the story. And how when I was put on pain medicine, I was able to function again. And now I go to my doctor, and he says, because of the CDC and because the DEA is going to take my license away, I have to forcibly take you off your pain medicine, take you off my pain medicine, in a first voice, that I was on for years, and it worked. So the government is interfering with my doctor, and I don't like it, and my doctor doesn't like it. Thank you for listening. And I can be contacted at, and you leave your name and phone number if you do it by leaving a message or you do it by email. And they will collect these. Believe me, they don't throw them away. They collect them all up. Do not fax them, however. I learned that a lot of times the fax machine in the office, nobody puts paper in it. So stick with phone calls, emails. You can send letters, or you can drop by and visit. This is part of their job. It's actually a constitutional provision that Congress serves the right of people to ask for redress, which means Congress's job is to listen to the people in their districts and solve their problems. It's actually a constitutional protection we have. So
I have to imagine then they get a lot of people that come in and want to talk to them. What is the wrong way and the right way to do this? Because I have to imagine there's a wrong way, and it could get pretty boring probably if, or I don't know.
Yeah, the wrong way is to go on and on and on with a lot of details. Remember, these people have steel-trapped minds. They can pick up on stuff in 3 sentences. And most good senators and representatives, if you come to the office, they get the message in the first 3 sentences. So it really has to be brief and to the point, and you can even practice it or do a little draft if you're going to send in an email message. Don't put anything extraneous in there. Don't put anything negative, like I hate my doctor, or doctors are all idiots. You just put in what your problem is. You've been reduced, you're undertreated because the government is interfering with your doctor's practice. And then give some examples of what it's like to have your disease, because they don't know. People don't know what interstitial cystitis is, or arachnoiditis, or complex regional pain disease. You got to tell them. Say, I have this disease. And that also helps with a misperception that when people use the word chronic pain disease, everybody thinks, oh, yeah, right. They're just faking. But if you say you've got this particular disease, then they know. I have inoperable back disease after failed surgery. That's a syndrome. I have lupus. I have psoriatic arthritis. Always just don't list 9 diagnoses. Just list 1 diagnosis, your best one. And here is an example of how pain medicine helped me in my life. And now they're taking it away.
Right.
What's going on here? Help me with this. So simple messages work the best.
Okay. And then should they bring in any information when they're coming in with them?
If you go into the office, it's maybe just print up what you're saying to them. In other words, that's like a press release. Press release, you hand out the written copy and then you talk it. That's what a press release is. So you're kind of like a press release. In other words, as a matter of fact, you could even read off of it as kind of a little cheat sheet and then hand it over to them. And then they can file it away as to the exact thing that you just told them. And that's okay to do. If you have other information, if you want to take my palliative care that Carolyn Concia, nurse practitioner, and I put together, you can get that on the internet by plugging in a medium palliative care form, Kline, Kline, and you'll get both the article and the form, which you can show to the office people. Say, we want to move on this idea because this protects the doctor and it protects me from arbitrary reductions in my pain medicine. So.
And that's how palliative care works exactly.
Palliative care is, it's an important issue. It's something that we doctors have done for centuries, which is if somebody has a disease that cannot be cured, we still take care of the patient, and so if people that have lung cancer and have intractable coughing, we can give them medicines to stop coughing. even though they've got a disease we can't treat. So if you have interstitial cystitis or Ehlers-Danlos syndrome or arachnoiditis and you have this terrible pain and we can't cure the disease, we can still treat the symptoms. And that's called palliative care. There's nothing magic about it. Doctors can do it in their offices. But the nice thing is the first sentence of the CDC regulation says palliative care is exempted from all that's going to be said in the regulations. All the 90 milligram stuff, all of that is exempted. Most states, if you just Google opioid laws and then put your state in, most of the states also exempt palliative care. So people say, oh, we need to make it a law. No, you don't. It's already a law. If it says in the state law, this exempts palliative care, any restrictions on pain medicine is exempted, that's the law. Now, the CDC is not the law, but it's still in there. Go ahead.
Is there a list of what's under palliative care, or is it just, the definition?
Well, the definition is in the article that Carolyn Concia and I wrote. She's a nurse practitioner, and she practices palliative care. We've cobbled it together from a lot of other definitions to make it clear. One, you have to have a disease that's incurable. Two, you have to be able to benefit from symptom relief. So in other words, if you've got intractable coughing, then you can benefit from having that reduced. Or if you have pain, you can benefit from having that reduced. And the third thing we added is because of the great misconception that it has to do with hospice, because it doesn't, right, is that this disease could potentially shorten your lifespan. So somebody who's sitting around in pain that can't exercise, somebody who sits around with high blood pressure from their pain, increasing risk of stroke and heart attack, could potentially have a shortened life. Now, that's no different than, somebody who has a lot of bad habits and drinks too much or smokes too much or eats too many donuts like me. Then that's going to potentially is the key word, shorten your lifespan. So it's those three things. And
what do you have to say, though? Because I've heard people say to me, well, my doctor didn't even know what palliative care was, and they don't accept that. Like they asked, what could they do then?
Well, what they need to do is get hold of my article and Carolyn's article that we wrote and read it. And the best way to do that is to download it, from Medium. And you can always email me or Jonelle. We'll get you a copy. And then you don't take it into the doctors. You send it in ahead of time. Because if you take something into a physician's office and drop it on their lap, they're going to get defensive. So what you do is you send it in, you say, doctor, I feel like I might qualify for this, and here's a little certificate, and why don't you read it? Now, when the doctors read it, they're going to discover something that I put in there. They're going to be able to make more money because people with chronic disease, rare disease, require more time on the telephone with the horrible stuff going on in pharmacies, arguing with a radiology department, talking to other members of the team. Previously, we could not bill for that. Doctors can only bill when you're sitting in the office. But CMS, which is the Medicare, Medicaid administration, very nicely provided us with new billing codes that we can now bill for this time when we're not with the patient. And this is a way physicians can be properly reimbursed for the amount of time they're spending. I can't tell you how much time I spend with these pharmacists, not pharmacists, but benefit managers. The pharmacists are trying their best also, denying and then calling me up and denying it, and what they're trying to do, I found out from an inside source, by making it hard for patients to get their medicines, by requiring a doctor for free to spend 20 to 40 minutes on the phone trying to get the patient's drug approved, a lot of doctors just say, forget it. Well, when they forget it, then the drug company, the benefit manager, doesn't have to provide the medicine to the patient, and they keep the money. And they're cutting deals with manufacturers all the time. They actually use it to twist the arm of the manufacturers to give them more of a discount that they could keep as a benefit manager. And so then the manufacturers get nervous. They give a discount to the benefit managers. And then the benefit managers don't have to threaten them anymore with prior authorizations.
Right.
See how it works? So the patients get screwed. The doctor gets screwed because people with busy offices are seeing patients every 15 or 20 minutes. So you spend 40 minutes on the phone for nothing with a drug company who's basically trying to squeeze some manufacturer for more money. So this has got to stop. And this is one of the things we're going to bring up with Congress. The benefit managers really can actually, according to the people I've talked to, could disappear tomorrow, and patients would have better access and lower cost.
Wow. What about this, too? We have a question. If you get a waiver for palliative care, but you can't get the medication because the manufacturer has reduced the supply and it's not available, what do you do at that point? Because if you can't, it would be pointless to get the waiver if you can't get the meds.
Yeah, what you see the insurance companies are screwing the patients by saying, well, you can have all you want if you pay for it. We're just not going to pay for it. This needs to go to Congress. You see, this is something Congress can help out with. And there is a way to appeal insurance companies. Now, benefit managers I'm not sure about, but we'll have to check into that, Jonelle. But there is an insurance commissioner in every state. And if you have a problem with an insurance company, no matter what it is, you file a complaint with the insurance commissioner. And I think we need to look into this and more people file complaints and say, look, last year I was getting my medicines for $10 and now I'm paying $100. And here I am, I have this palliative care certificate, and just try to push the issue. You see, without federal regulation or state regulation, benefit managers and drug insurance companies can do whatever they want. So we need to work on that end of things too. But people forget about the insurance commissioner. You can always file complaints.
Who does that go to when you file a complaint?
Well, insurance commissioners hold the ability for licensing insurance companies. For an insurance company to practice in a state, they need a license. If I'm a doctor, I need a license. If I'm a hairdresser, I need a license. So if you have a problem with a person who has the license, you go to the licensing agency. Hospitals are licensed through the Department of Public Health. If you have a problem in the hospital, you go to the Department of Public Health and put in a complaint. Insurance companies are licensed by, you have to figure it out for each state, but generally by the insurance commissioner or insurance commission or something. So you find out where they get their licenses, and those are the places you file complaints. Because if you can file too many complaints, if you file 1,000 complaints against a hospital, then the licensing agency, the Department of Public Health, will come and shut the hospital down. If they get enough complaints about an insurance company, then they'll shut the insurance company. They'll take their license away. So that's how you get control, because all of us with licenses are at the whim of the licensing agency. So,
overall, who is there something that is put into place, or do you think that there will be put in place? So what has happened right now with everything, with us, with medications, everything, will this ever happen again? And how do you make sure it doesn't happen again? Because, you said earlier, they're going to look back and say this is like one of the worst blunders in the history of America. So Who would?
Well, there's a good parallel with the Internal Revenue Service. About 20 years ago, the Internal Revenue Service had armed agents going out investigating people, and they tried to collect thousands of dollars of overdue taxes from a minister, a priest actually, up in Minnesota, I think it was. And so they put in a complaint. They got a congressional hearing going. And congressional hearings are to gather information for potential change in the law. And they felt, after hearing testimony, that the IRS was so far out of line and turning into a Gestapo, they passed new legislation and they prevented the IRS from ever going after people like they were crooks and violating their due process. Well, we need the same thing. We cannot let communicable disease agencies get out of line and start publishing medical recommendations. The federal drug police need to have certain restrictions. They need to operate off probable cause. All these kinds of normal legal protections they need to have, just like the FBI has and just like other federal police agencies have. A doctor whose patients go out and sell their medicines. I mean, you can get $1,000 for a bottle of Percocet. The doctor is charged with a federal crime of drug trafficking, like El Chapo, because the patient sold their drugs. It's called Section 1301 of the DEA regulations. And they're using that to try to convict doctors of being drug lords because their patients decided to sell their prescriptions unbeknownst to the doctor. So we need to have another congressional hearing about this, talk about it, find out if it's true. Maybe the information I have is wrong. But that's what Congress is for. And our greatest form of democracy, in my opinion, in this country, are congressional hearings. Because congressional hearings allow anybody to come in and tell Congress what's going on. And they're also very good about finding out things. They have staff, they have lawyers, they know how to find out stuff. And you're compelled to come in and testify before Congress. Most people do it voluntarily, but they have the power of subpoena. So they can really dig into it, get the information, and then recommend changes in the law. That's how a democracy works when it gets out of hand. So,
has that ever happened? Is there an example within history that happened?
Yeah, there's been a lot of regulations put on industries over the years. Insurance companies are under tighter regulations to make sure they have enough money set aside to pay all their, all their claims. The IRS, like I just mentioned, this is an ongoing process. I mean, every day there are hearings in Congress, and every day they're coming up with new laws. And in the first part of last year, a protection law was passed for doctors mainly, where the federal drug police now have to show probable cause before an arrest. Wait a minute. This is standard in every small town, every state, in all federal agencies except the DEA. All the DEA had to do, because it involved demon drugs, was show there was a potential harm to the public.
So nobody's watching that.
And nobody is watching that. The DEA answers to the Attorney General.
Okay.
So there's no watchdog. Congress has committees and stuff, but there's no like community police in Raleigh, where we are, North Carolina, and the D.C. police, I think too, have citizen committees that monitor what's going on in the police department. You can file a complaint and then they check into it. It's a check and balance thing. There's no check and balance for the DEA or federal drug police.
And has there been issues with them in the past? I mean, or Like, why is this gone on so long?
I don't know. I'm not a politician. I don't know that much about, the checks and balances. Maybe the DEA has some. But the DEA has a reputation of being a strong, forceful federal police agency because they are mandated to do that by law. See, it's interesting that the FBI is mandated by law to, have jurisdiction over certain things. The DEA is a police force that was by law assigned to carry out Richard Nixon's 1970 Controlled Substance Act. So that's odd. You've basically got a federal police force that is carrying out one legislative act. So Richard Nixon put in all this horrible stuff in the law, as was confessed by John Ehrlichman 25 years later, basically trying to catch his political enemies. So he could go into a Black Panthers meeting, find some cocaine, charge them all with drug trafficking, 20-year sentences, because they had a bag of cocaine. And these laws were kind of set up that way. They have all kind of conspiracy charges that can be levied against you. Doctors who prescribe out of their homes or offices suddenly are using their facilities, for drug trafficking. And so all of these laws were intended originally to catch hippies and black folks and all the enemies Richard Nixon had. And now it's being used for doctors. And doctors have been under the gun since 1915. This is not the first time. So.
Okay. Man, that just blows my mind. I'm just thinking about it a little bit more about, that they have no checks at all. It just doesn't, that's crazy.
Yeah, they answer to the Attorney General, so, it depends on what the Attorney General is, what their viewpoints are, and Attorney Generals differ,
Mm-hmm.
That's their boss. There's been evidence of ignoring federal court judges. They have 2 cases. There's a couple of problems in Congress not answering questions. This sort of stuff, political stuff. I'm not much into politics, but I hear these things, and they're, like I said, a very powerful police force because they are mandated by the law.
Right.
So it's the law that's the problem. It's the 1970 Controlled Substance Act that's the problem. I mean, you can't fault the DEA for following the instructions of the law. You can look into what the DEA is doing about how the law is being applied to practicing physicians instead of El Chapos and, drug cartels.
Right.
So.
Well, and also though, isn't it's not just the DEA, but isn't that why they were created though? I mean, by him, by Johnson, or no? Was it?
No, by Richard Nixon. Yeah, no, they used drugs as an excuse to attack political enemies.
Right. So basically, it was to take their enemies, like within.
Yeah.
Politics. I mean, that's pretty crazy.
So, the question is, how much should the federal government be regulating prescription medicines? The DEA has charge of how much is being manufactured. Good Lord, this is a federal police force who's deciding how much pain medicine should be manufactured? And they're thinking...
Okay.
Go ahead.
I know there's shortages all the time of different medications, but has there ever been shortages like what's going on now with pain medication?
Yeah, it's starting to look that way. You see, there's a belief in the anti-opiate world that if you take the medicines and make them harder to get, that will prevent heroin overdoses in the streets. That's really not very good logic.
No.
Because anytime you reduce the supply, you increase the black market. The black marketeers and the cartels are just love this kind of activity on the part of the DEA. Please cut back, because then we can sell more. I mean, this is, I can't answer that question. You know, this is what Congress needs to ask the DEA.
Yeah.
What is your rationale? And do you understand how the black market works? And do you understand supply and demand?
Right.
And there's supposedly 1 million addicted people in the United States. That's 3 or 4 per 1,000 people. There's 10 million people that need this stuff for their medical diseases, 10 times as many.
Yes.
So the DEA is going to cut back on pain medicine, thinking that it's going to reduce heroin street overdoses or fentanyl overdoses or any kind of overdose. How's that going to work? In the meantime, we go to sacrifice 10 million people with serious, rare pain diseases in the meantime.
Well, not even
is it that
not
important?
Not even that. People are waking up after surgery and they don't have any medicine. They don't have it. They're not getting even a drip or of anything. Like they're giving them pills.
Well, I just, as a practicing physician for 40 years, find this unbelievable. It's just unbelievable.
Yeah.
That a surgeon would operate on somebody, especially orthopedic surgery, very, very painful afterwards. Knee operations are very painful. Hip operations are very painful. And to say that you're not going to get any pain medicine afterwards, and the answer would be, why, doctor? And the doctor says, because that's what the CDC says. The CDC didn't say anything about this. There's nothing in there about the CDC recommending you don't get pain medicine after operations. It's punishment, really. I think physicians have for so long felt that anybody who wanted pain medicine, who asked for it, was a junkie.
Right.
And so now they're punishing everybody. If my surgeon told me that I had to have a knee operation, I wasn't going to get any pain medicine afterwards, I would cancel the surgery. I would not go through that without pain medicines. Cancel the surgery and say, look, when you get your ethics back and when you get your post-operative care back that you're required to do, give me a call.
So what do you do?
I would not allow that to happen. Yep.
Well, I've heard some people also, I mean, they just weren't even aware to ask that or not ask it, and they got surgery and they woke up and they're getting nothing, you know? So, like, should they, do people need to ask that first of all, and then do you have somebody sign something so to make sure that they follow through with it? I mean, what do we do here?
Well, it's become so commonplace. You need to get it in writing from your doctor, and you need to get in writing what the dose is going to be, because I've heard people say, oh, they give them 5 milligrams of oxycodone, which is enough for an 8-year-old. You know, if an 8-year-old had surgery, you give them 5 milligrams of oxycodone. And so you need to work it out. And if it looks like they are not in favor of giving you full treatment, pain control after the surgery, I would just not go for the surgery unless it's an emergency. You know, or try another doctor, call another hospital. Well, I'll tell you, hospitals don't like losing surgery. They make tons of money on it. And the other thing is, I think that's a reason to file a complaint with the medical board in the state. That's torturing people. They kind of got a leg to stand on. There's nothing in the CDC regulations about it. And, of course, they're voluntary anyway, but there's nothing in there about surgery or the emergency room. So I think that's file a complaint with the board. You know, even though the board doesn't do anything, they will send a letter to the doctor and say, look, your patient has complained that you're not providing pain care after you've operated on them. What's going on here? You know, I mean, this is like if somebody came from Mars and dropped in and said, what are you doing? What are you doing to people? You're operating on them. You won't give them any pain medicine. Would you mind telling me why you're doing this? And why your license shouldn't be taken away from you for torturing people like this?
Can you die if you don't get pain medicine after surgery? Or
well, that's an interesting question. I don't have an exact answer because I'm still looking it up.
Okay.
But one of the things that can happen with severe pain is elevated blood pressure.
Right.
And as a matter of fact, that's actually one of the symptoms in science we call it. Symptom is something somebody tells us. A sign is something we measure. So blood pressure is a sign. So when somebody comes to the office and says they're in extreme pain, we take their blood pressure, and it goes, good heavens, this is kind of high. That's a sign the person really is in pain.
Right.
So what happens to somebody post-operative who's in agony and who drives their blood pressure up to 200, which can happen? Are they being put in risk of having a stroke or a heart attack? Yep. Blood pressure is associated with heart attacks and strokes. So the connections between the two. Yeah. Say again.
Stacey Fields from YouTube says she asked in a poll and 60% told her that they are not having a surgery or procedure because of lack of pain of care.
Excellent. And when the bean counters at the hospitals start going, hey, where's our revenue from all this surgery? I mean, they get tons of money from surgery. Believe me, it's their big revenue maker. Yeah, they're going to start asking questions. So people, unless you've got emergency surgery or something, just boycott. This is the old-fashioned boycott. Just don't get surgery. And if you're up to it, go out with signs in front of the hospital. No pain medicine after surgery. Get your surgery somewhere else. You know, that'll wake them up.
In other countries.
Yeah, or again, contact the newspapers, get 5 or 6 people together who were denied surgery, what it was like if somebody's gone through post-operative with no pain medicine. This is such a fundamental violation of the practice of medicine. I find it unimaginable that people are actually doing this, but they are.
Did you ever, years and years ago, did you see that this could happen, or was there anything that let you know that this was going to happen like this, or no?
No, a little bit. Yeah, doctors have had kind of a negative attitude toward pain and pain medicine all along because we just are not taught properly. We don't hear it in medical school from patients. We need to hear from patients who have these terrible diseases. But I never would have predicted that what's happened in the last 2 years, and it gets worse every day. They're getting veterinarians to watch out because somebody brings their dog in and is really some kind of junkie. So, be careful. No, I'm not kidding you. They're passing laws about veterinarians, dentists. Oh, no, don't prescribe any more than 90 milligrams, you dentist. Or else you're just going to have all these addicts on your hand, This is crazy.
Well, what dentist, does that? You know what I mean? It doesn't matter, actually. But, seriously, though, they just took it to such a high level. It doesn't make sense. It's ridiculous. All of it is.
Yeah. So I heard the other day somebody had these, wisdom teeth yanked out, or an abscess it was, and no pain medicine there. Just take some Motrin because now the dentists are all frightened, and they're passing laws. Oh, dentists shouldn't give any more than 90 milligrams. And lo and behold, when they get out the CDC regulations, there's nothing in there.
Right.
About 90 milligrams for dentists. And it's everybody just jumps on the bandwagon, and oh God, we don't want any more dope fiends. But we're not actually having more dope fiends or people with addiction disease. All we're having is an increase in street overdose deaths. And that occurs whenever the government starts to crack down. The death rate goes up. And it's happened again. It's got nothing to do with doctors' prescriptions because the CDC fibbed and did not include in their report that for 6 years prior to the publication of the CDC guidelines, two years ago, that the prescriptions had already dropped off by almost 20%. And yet the street overdose deaths were increasing. So where is their logic? Wait a minute. Too many doctors' prescriptions cause street overdose heroin deaths, but they're actually dropping, and the overdose deaths are rising. Oh, gee. Oh, I know. Maybe we haven't dropped it enough.
Right. So that's what they'll be doing next year, right? Like part 2 of that.
Next year they'll say, oh, no, we got even more deaths. And, of course, it's from restrictions and increased policing, all the things that we've known for 50 years cause more deaths in the streets. Oh, no, it's more doctors' prescriptions. It's the kind of logic that's called post hoc logic. It's ergo propter hoc something. It's a form of a logical fallacy. And it's the rooster crows before the sunset rises. And then the sun comes up. Therefore, the rooster crowing causes the sun to rise.
Oh, okay.
So, lots of doctors' prescriptions, increased deaths. Whoa, the old rooster.
Right. Except it makes no sense now. You know what I mean? It's not making sense.
Of course, it doesn't make even the faintest logical sense.
No.
And this is what every kid in 10th grade science learns. 2 things that are related are not necessarily causal. But boy, they just jumped on the bandwagon. Everybody bought into it. And that's kind of funny because there have been so many theories since 1999, the drug companies. Since 1999, Purdue and OxyContin. In 1982, 2 doctors wrote an article in the New England Journal and said, you know what, I think addiction's kind of rare. And they jumped all over them and said, these 2 guys started the epidemic. I read the other day that nurse practitioners and physician assistants started the epidemic. And drug companies in general started the epidemic. And heroin started the epidemic. And fentanyl started the epidemic, all since 1999. Guess what happened in 1999? That was the first year CDC started collecting data.
Really?
So no wonder all the increases in everything have occurred since 1999. So all these people go back to 1999 and go, what was happening here? Oh, we had OxyContin. We had doctors prescribing too many drugs. We had Porter and Rick, who were the 2 doctors in Boston. And we had all these other, conspiracies coming from the drug companies, lying and all this kind of stuff. And Purdue lied, and they got fined $600 million. But the other drug companies are just doing business as usual, which is pushing their medications like they always do. And by the way, go ahead.
Good. Oh, did the CDC were they? So they're collecting data. So suddenly, was it only on this, or was it on other things too? I mean,
part of CDC's mission is to collect data on poisonings.
Okay, right.
That's just one of their jobs. They collect data on poisonings. So now they consider drug overdoses as poisonings.
Right.
Okay, so they can collect data on that, and then they present the data if it has to do with prescription drugs, they would present the data to FDA or possibly to the National Institutes of Health and say, here, we've got this data, you guys take care of it. But they stepped out of line and they thought they should take care of it themselves.
Well, that's the other thing. That's one of their main jobs is to collect data, and yet they made a big screw up publicly, and admitted it, about the inflating the overdoses. Shouldn't they be held accountable? Shouldn't they have to go in front of Congress and say, hey, look, we screwed up? Shouldn't they have to take a step back a little bit maybe? Because And shouldn't every rule, law, whatever that's going on, or any possible stuff coming up, be just completely hacked and like they have to get the correct data and information before they could do anything?
Absolutely. They failed in their job of collecting the data.
Right.
They lied about the data, and here's how they collect data. A person who dies on the street has an autopsy, and they do blood work, and they find out that the person died of alcohol, heroin, antidepressant, and a prescription drug.
Right.
Whether it was prescribed or not doesn't make any difference. So then they take all those 4 things and they count each one individually as a cause for death.
So as if it was 4 different deaths.
As it were 4 different deaths.
Right.
So most all the deaths from street overdoses are mixed. Most all are mixed. They've got, 4 or 5 drugs. So I actually wrote a letter to the CDC, to the man in charge and his boss of these statistics. And I said, how many people have died only from prescription drugs?
Right.
Not mixed with other drugs, just only prescription drugs. Haven't heard back. It's been 2 months.
Do they know?
They know. Yeah, they know the answer. I'm going to get my congressman. Yeah, they know. There's not saying. Because I think probably the number of, they're holding this, they're making overdose deaths, which are people dying in the streets from taking whatever they want, as being some kind of like Marilyn Monroe overdose. Like this is going to affect the general population. This has got nothing to do with the general population. Their overdose deaths need the word in front of it, street overdose deaths. That's not fair. It's like me saying, oh, you know how many people died from vehicular accidents last year? Right. What kind of vehicle? Motorcycles, boats, trucks, drag racers? I don't know, So that's what they're doing, you see, by saying overdose deaths, which is scientifically dishonest. And that's why I am saying these regulations or these suggestions are fraudulent, because they know very well, these are scientists and epidemiologists, they know very well to use exact language.
Right.
You don't say all vehicular deaths. You don't say all overdose deaths. Good Lord. Overdose deaths include people who've died from taking aspirin, drinking antifreeze, dying from their antidepressants, dying from antibiotic-resistant bacteria. And they list those. 60,000 people, they say, die from overdose deaths.
Let me ask you something. If they know that people are, if they have this data and they're purposely lying, why did they come out publicly that they've inflated the numbers? Did they get found out, or what? Or was somebody going to blow the horn on them?
I don't know. Maybe it was my letter.
You never know.
You never know. I basically I didn't ask for more data. I asked for specific data, which they have. And I don't know. It was a month later that this came out. It was, we mentioned this before. It was published in an obscure journal that you got to pay $35 to even get a copy of. And it was the whole bunch of unknown authors, except one. One of the authors was one of the 3 authors of the CDC guidelines.
Okay.
And she was the author, and basically if you put out wrong data and you got a whole bunch of people supervising, then you got to say, hey, was this really an honest mistake, or were you lying?
Right.
And I'm sorry, they have enough professionals in the CDC. We always consider the CDC to be like the penultimate scientific group. These are all hardcore researchers, they're not politicians, and they put out information about, epidemics, and, we always trusted them. But they got infiltrated by people that were described by one FDA official as lunatic fringe. They got lunatic fringe people writing the guidelines.
Well, all the people that are scientists and stuff like that are getting this data. Is there a different side to the CDC that puts out this data, or?
There's a bunch of honest scientists in the CDC. As a matter of fact, last year the CDC scientists complained there was too much politics in their business. Really? They're there to collect data, to warn people that an epidemic is coming. They never pass laws. They say things like, everybody wash your hands, we've got this epidemic coming. And they're real cautious about collecting the data, trying to predict when the epidemics are coming. And that's why they use the word epidemic, by the way, for opioid epidemic. Well, hate to say it, but an epidemic is a rapidly rising number of cases, and they're, even though they claim they're rapidly rising, they're not, because one extra person per 100,000 people died, increased death rate from 2014 to 15, 2015 to 2016. Each year, the death rate increased by one person per 100,000. Now, I tell people, you make up your own mind about whether you think that's an epidemic, because it's a judgment call. If you got a bunch of CDC scientists together and said, "Do you agree this is an epidemic?" I imagine they would all say no. It was their bosses and their people that wrote these regulations were anti-opioid fanatics. Hate to say it, but that's my take on it.
Wow. Well, Dr. Kline, thank you so much for sharing all that tonight with us. And did you want to say anything else before we wrap up here?
Oh, good Lord. I'm in enough trouble as it is.
You are. You created the whole epidemic. No.
Yeah, that's right. It was my fault,
Or at least that's why the CDC admitted, right? I like that.
Yeah, well, if I keep mouthing off like this, I will be cause of the epidemic. It'll be Kline. He did it.
Yeah. Alrighty. Well, are you going to come back tomorrow evening with us? Because I know we were talking about it possibly. Did you want to, or?
Well, if you buy me a box of donuts, I'll do anything.
All right. I think we could do that. So, and tonight's subject we'll do tomorrow, because I know there was a lot of people that were excited about that. So we definitely have to do that if we don't. All righty.
Sounds good.
All right. Thank you. Well, Call Nation, thank you so much for joining us this evening. And actually, we're at the Doctor's Corner tonight. I apologize. But we'll be back here tomorrow, 8/7 Central. Tomorrow, Dr. Kline and myself and, there's 14 of us. We will be speaking at the congressional hearing. You could watch it off of C-SPAN. It's between 12 p.m. and 2 p.m. Eastern Standard Time. I hope you all have a great night, and I'll see you tomorrow.
You've been listening to The Doctor's Corner with Dr. Kline and Jonelle Elgaway. Copyright 2018 by EXG LLC. All rights reserved.